Ozempic, it is literally the hottest drug in the country right now. But what happens when you stop taking it?
Have you ever wondered if Ozempic is truly the miracle weight loss solution it's hyped up to be? Are you worried about the side effects they don't talk about? If you're even considering using Ozempic for weight loss or managing type 2 diabetes, this video could save you from making a decision you'll regret later. While Ozempic has helped thousands shed pounds and control blood sugar, there's a hidden side to this medication that most people only discover after they start using it. In this video, we're digging deep. I'll walk you through the lesser-known side effects that can dramatically affect your daily life, the truths most doctors don't emphasize, and the reasons why this may or may not be the right solution for you. What is Ozempic? Ozempic is a prescription medication used primarily to help manage type 2 diabetes. The active ingredient in Ozempic is semaglutide, which belongs to a class of drugs called GLP-1 receptor agonists. These medications work by mimicking a hormone in the body known as glucagon-like peptide 1, GLP-1. GLP-1 plays a critical role in regulating blood sugar levels, slowing digestion, and reducing appetite. When taken, Ozempic helps the pancreas produce more insulin in response to rising blood sugar levels after meals. At the same time, it lowers the amount of sugar released by the liver and slows down how quickly food leaves the stomach. These combined effects help keep blood sugar levels within a healthy range. In addition to its primary use for diabetes management, Ozempic has also been recognized for its effects on weight loss. However, it's important to note that Ozempic is not officially approved as a weight loss drug. It is designed specifically for treating type 2 diabetes. The medication is administered as a once-weekly injection, typically in the abdomen, thigh, or upper arm.
A new study shows people with type 2 diabetes using the active ingredient in Ozempic and Wegovy maintained improvements in blood sugar control and weight loss for 3 years. The study involved more than 23,000 people over 3 years.
It is prescribed by healthcare providers after a thorough assessment of the patient's condition and medical history. Let's now dive into these 3 major less-known side effects of Ozempic. Just a quick reminder, this video is for educational purposes only, so do speak to your doctor if you have any medical concerns. With that said, let's jump in. Number 1. Vivid or unusual dreams. The first side effect of Ozempic is the occurrence of strange or vivid dreams. Numerous users have reported experiencing dreams that feel incredibly realistic, intense, or just downright bizarre after starting the medication. While vivid dreams themselves are not harmful, they can feel unsettling or even disruptive for some individuals. The exact cause of this phenomenon isn't fully understood, but it could be related to how the drug interacts with the brain's neurotransmitter systems. GLP-1 receptors are found not only in the pancreas but also in the brain, where they influence a variety of functions, including mood, cognition, and sleep patterns. By activating these receptors, Ozempic may unintentionally alter the normal architecture of sleep, leading to heightened dream activity. Interestingly, some users have noted that their dreams often revolve around food, which ties back to the medication's effect on appetite and cravings. Others have described dreams that seem unrelated to anything in their waking life, making the experience even more curious. For most people, this side effect is harmless, but for those who find it disturbing or who suffer from disrupted sleep, it might require consultation with a healthcare provider. Some individuals have even reported noticing patterns in their dreams, such as recurring themes or symbols, which they had never experienced prior to taking Ozempic. This has sparked curiosity among users and researchers alike, leading to discussions about how the medication might influence subconscious thought processes during sleep. Some speculate that these vivid dreams could offer insights into deeper psychological or emotional states, acting almost like a window into the subconscious. Others view them as merely a quirky side effect, but the connection between Ozempic and dream activity remains an area ripe for further exploration. Some researchers speculate that these altered dream patterns could be linked to changes in REM sleep, the stage of sleep most closely associated with vivid dreaming. Additionally, anecdotal reports suggest that the intensity of these dreams might fluctuate depending on dosage or how long a person has been taking the medication. Some users have even reported that the dreams become less intense or frequent over time as their bodies adjust to the medication, while others notice certain triggers, such as eating specific foods or taking Ozempic at a particular time of day, that seem to influence their dream patterns. This has led to speculation that individual factors, like metabolism or sleep habits, might play a role in how this side effect manifests. Moreover, the emotional context of these dreams has also drawn attention, with some users reporting unusually vivid nightmares or dreams that provoke strong feelings, such as fear, joy, or nostalgia. These emotional undertones further highlight the complex ways in which Ozempic might influence the brain's deeper cognitive and psychological processes. Some researchers are now investigating whether these dream experiences could serve as indirect indicators of how Ozempic affects neural activity beyond its primary metabolic functions. This has opened up intriguing questions about the broader impact of GLP-1 receptor activation on the brain, especially in areas related to memory, imagination, and emotional regulation during sleep. As researchers delve deeper, they are also considering whether these dream phenomena might vary based on individual brain chemistry or genetic factors, which could explain why some people experience such vivid effects while others do not. This growing interest underscores the need for further studies to unravel the complex relationship between Ozempic, sleep architecture, and cognitive processing. Number 2. Distorted sense of taste or food aversions. One of the more unusual side effects of Ozempic is its ability to alter how people perceive food. Many users have reported a sudden dislike for foods they once enjoyed, while others have experienced changes in the way certain foods taste. Some describe flavors becoming dull or even unpleasant, with specific aversions often tied to rich, fatty, or sweet foods. For example, a person who once loved pizza might find the thought of it nauseating after starting Ozempic. Why does this happen? Scientists believe the phenomenon is linked to the drug's effect on appetite regulation. GLP-1, the hormone that Ozempic mimics, influences the brain's hunger and reward centers. By slowing gastric emptying and reducing cravings, it can unintentionally make certain foods less appealing. This is particularly common with calorie-dense, highly processed foods, which might explain why people feel more inclined to avoid junk food while on the medication. While some users embrace this as a helpful side effect that supports weight loss, others find it frustrating or inconvenient, especially when it interferes with enjoying meals or social dining. In some cases, people report developing aversions to foods they used to rely on for nutrition, forcing them to rework their diets. This can be particularly challenging for individuals with specific dietary needs or restrictions, as they may struggle to find suitable alternatives that align with their nutritional goals. Additionally, these changes in food preferences can affect daily routines and social interactions, making meal planning and dining out more complex. Some users have shared that these shifts in taste preferences extend to beverages as well, with drinks like coffee or alcohol suddenly becoming unappealing. This unexpected alteration in both food and drink choices often requires significant adjustments, particularly for those who have long-standing habits or rituals tied to their meals. Some individuals have even noted that these changes can lead to a decreased interest in cooking or preparing meals they once enjoyed, as the anticipation of eating feels less rewarding. This shift in behavior underscores the profound way Ozempic can influence not just physical cravings, but also emotional and psychological connections to food. Some users have also observed that these changes in taste preferences can create a ripple effect on their overall relationship with eating, leading them to explore new cuisines or healthier options they might not have considered before. However, for others, the unpredictability of these shifts can feel overwhelming, particularly when long-standing comfort foods or dietary staples no longer appeal. This can lead to a sense of disconnection from familiar eating habits, leaving some individuals feeling uncertain about how to approach meals. Additionally, the need to constantly adapt to these changes can add an unexpected layer of stress to everyday life, particularly for those who find comfort or routine in their food choices. For some, this constant need to reassess meals and eating habits can feel like a loss of control, disrupting not only dietary routines but also emotional ties to food. Number 3. Gastrointestinal oddities. It's no secret that many medications come with digestive side effects, and Ozempic is no exception. However, what makes its gastrointestinal effects stand out is their unpredictability and, in some cases, unusual manifestations. Common issues include nausea, bloating, and constipation, but some users have reported stranger symptoms, like an odd gurgling sensation in the stomach or an inexplicable feeling of fullness that persists for hours, even after eating very little. These effects occur because Ozempic slows down the rate at which food moves through the digestive system, a mechanism known as delayed gastric emptying. While this is one of the ways the drug helps people feel fuller longer, it can also lead to discomfort, especially if the digestive tract becomes sluggish. Another odd symptom some users experience is a phenomenon known as burp reflux, where burps taste like recently consumed food, even hours after eating. Though not dangerous, it can be off-putting and may discourage users from eating altogether. For most people, these effects diminish as the body adjusts to the medication, but for others, they can be persistent and frustrating. Some users have also reported peculiar bowel habits, such as alternating periods of constipation and diarrhea, which can add to the unpredictability of the drug's gastrointestinal effects. Additionally, there are anecdotal accounts of individuals experiencing excessive gas or unusual stomach noises, further highlighting the diverse and sometimes perplexing ways Ozempic can impact the digestive system. Some users have even noted a sensation of their stomach churning or making exaggerated movements, which can be both uncomfortable and embarrassing in social settings. These peculiar gastrointestinal effects serve as a reminder of the complex ways in which Ozempic interacts with the digestive process, often leading to experiences that are as varied as they are unexpected. Some users have also reported experiencing a peculiar sensation of bubbling or effervescent-like activity in their stomach, which they describe as feeling similar to carbonation moving through the digestive tract. This odd effect, though harmless, can be distracting or uncomfortable, particularly when it occurs during moments of rest or in quiet settings. In conclusion, Ozempic has revolutionized diabetes management and sparked widespread interest as a weight loss aid, but its effects extend beyond what's written on the prescription label. From altering taste and triggering food aversions to influencing sleep, digestion, and even mood, the drug has left many users marveling, and sometimes baffled, at its range of side effects. While some of these quirks may be manageable or even beneficial, others can be disruptive, requiring adjustments or medical advice. If you're considering Ozempic or are currently using it, being aware of these potential side effects can help you better understand your body's reactions and make informed decisions about your treatment. As always, consult with your healthcare provider if you experience any unusual or concerning symptoms while on the medication. After all, understanding how your body responds to a drug is an essential part of achieving your health goals, whether that's managing diabetes, losing weight, or simply improving your quality of life. Thanks for watching. Stay informed, stay safe, and don't forget to subscribe for more helpful health content.